The latest statistics suggest that unless a second wave of infections overwhelms our emergency services, Australia is likely to avoid the devastating death tolls currently seen around the world. Now, it's important to remember that not everyone taken to hospital with positive COVID-19 results goes into the ICU. In Victoria, for example, the total number of COVID-19 patients in hospital far exceeds those who end up in intensive care. In Australia, as of mid-July, just over 200 confirmed COVID-19 patients have been taken into intensive care since the initial domestic outbreak. Of those 200 admitted to ICU, 170 survived and 30 died. That 15% is the key statistic that Australians should take comfort in, especially when compared globally with other first world countries like the United States, who are overwhelmed and yet to contain the crippling first wave.
I heard that our volume is just exploding, and we have so many people in the hallways that are all COVID positive. Things are just totally crazy right now. Everyone is COVID positive in these hallways. All you hear is oxygen. And we're about to walk into the second tent that now has patients. And we're just walking through. So as you can tell, we've got patients in each bed.
That is a staggering difference when comparing Australia's 85% survival rate to America's 30%. So, what's Australia done differently to be so successful? ICU expansions and medical equipment stockpiles have played a big part. In the US, we saw New York City brought to its knees over a shortage of ventilators and hospitals well over capacity, whilst in Australia, the federal government currently has an additional 7,500 ventilators on standby as a national stockpile. Across the nation, hospitals' intensive care units have either increased in capacity or are on standby to do so. Since the first wave of COVID-19 infections, Victoria's ICU capacity has increased from 476 beds to nearly 700.